If you clicked on this video, then you're probably wondering if you're pregnant or not. Hello there, welcome to my YouTube channel, and today we'll be talking about some of the signs that may indicate that you have a little bun in your oven. So the first sign I want to talk about is cramping. Yes, these cramps, they feel like menstrual cramps. What usually happens is this. After fertilization, it usually takes the fertilized egg about 6 to 7 days to travel from the fallopian tubes to your womb. And when it gets to your womb, it will start to dig through the lining of your womb, trying to bury itself or implant itself in it. It is this digging that will cause you to get this feeling like you're having menstrual cramps, and then you start to cramp and feel uncomfortable. You may even think that it is your period coming. No, it is your baby trying to implant itself in your womb. This one happened to me. I kept getting these cramps and they were feeling like menstrual cramps, so I thought, oh, I was going to get my period. But guess what? The period never came. It was the baby that came. Yes. So watch out for this cramp, and if you're having this cramp and still no period, I think you need to do that test. Again, you may experience some form of bleeding or spotting. Remember what we said about the fertilized egg trying to implant itself in the womb by digging through the lining? Yes, so this digging can also cause you to bleed or spot. You're waiting to get your period, but instead, you see this brownish stuff coming out of you, or you start to experience slight bleeding that will last for a day or 2 days. It is called implantation bleeding. And the difference between this and your normal period is that this is not as heavy as a period would be. And then it doesn't last for days like a normal period would. It is implantation bleeding, and it's just your baby trying to implant itself in your womb. But please note, every bleeding in pregnancy needs to be checked out by your midwife or your doctor. So don't stay at home and say it is implantation bleeding. No, please go to the hospital and have a chat with your midwife or your doctor. Another sign is morning sickness. I don't even know why they call it morning sickness, because for some women, this can last for the whole of the day. So you notice that you're no longer your usual self. You wake up in the morning, you are just tired. You have no strength, no energy. You just want to stay in bed and sleep. Even if you manage to get out of bed and do one or two things, you start to feel dizzy and you just go back to bed. You want to sleep the day away. You can't keep anything down. When you eat anything or you drink anything, you vomit. Sometimes the smell of the food alone will make you feel very nauseous. For some women, this can be very severe. For others, it is moderate, and then for some others, it is very mild. If you're just feeling like you're not your usual self, you have no energy and you can't keep anything down, please take a pregnancy test. Breast changes. So if you're very conversant with your breast, they may even be the first to tell you that you're pregnant, because you will start to notice that they feel heavier, there is an increase in size, or that there is pain in your breast or your nipples are getting darker. Now, sometimes your breast will feel hard to touch. When I was pregnant, it was my breast that first told me that I was pregnant, even before I missed my period. Because I remember looking at my breast one day and I was like, no, this is not my usual breast. And guess what? It was pregnancy. So if you're looking at your breast and you're like, no, this is not how it used to be, or you're having some changes and you don't know where the changes are coming from, take a pregnancy test. Another sign can be changes in appetite. So this can come in different ways. For some women, you notice that you're always hungry. You just finished eating now. In the next 30 minutes to 1 hour, you are hungry again. You just want to keep eating and eating and eating. And for some other women, you have no appetite. You don't want to eat anything. You just want to sleep, or you want to eat a particular food. I've seen women that during this time, they just want to eat one thing in particular, and that is the only thing they will have throughout the day. So it can come in different forms. Sometimes you notice that the foods that you liked before, you no longer like them. You now hate them. And the ones that you hated before, they are now your best. You just want to have them all day. For me, I hated eggs and chicken. In fact, I don't even like to eat food prepared with chicken stock. The moment you bring the food and I taste it, I already know if you prepared that food with chicken or not. I don't want to eat it. And another thing is this, I don't like to microwave my food. I just don't know how it's happened, but once you microwave the food, I am going to vomit. I just don't like it. So if you're having changes in appetite, you know what to do. take that pregnancy test. Frequent urination. Now, because you are growing a new life, your body is working very hard. There is an increase in blood supply to all the organs in your body, including your kidneys. And this is why you find out that you're urinating more often than usual. Another reason why you will experience frequent urination is the fact that your womb is also increasing in size. And this increase can put some form of pressure on your bladder. Other signs of pregnancy can include an increase in your vaginal discharge, bloating, constipation, and of course a positive pregnancy test. Listen, even if you don't have any of these signs of pregnancy, but your blood test is saying that you're pregnant, congratulations, because you are pregnant. I've seen a lot of women say, oh, my blood test says positive, but then I don't have any other symptoms of pregnancy. How am I sure that I'm pregnant? You are pregnant. If your blood test says you're pregnant, you are pregnant. Don't worry about all the symptoms. Trust me, some of these symptoms are not fun to have. A lot of women struggle in early pregnancy. They struggle to eat, they struggle to keep up with their daily activities. So if you're not having any symptoms, you're one of the lucky ones. You should be happy. Kindly click on that subscribe button, like this video, and share this video. Thank you so much for coming this far with me. See you in my next video. Bye.